My name is David Michel. I'm an orthopedic surgeon and I specialize in hip and knee replacement. Well, I decided to go into medicine because I always wanted to help people. Orthopedic surgery gives us a unique opportunity to change people's quality of life pretty quickly. The most common problems we treat is arthritis, both of the knee and the hip. Often patients are in their 50s to 60s, although we have done surgery on patients in their 20s to 90s. For hip replacement, we do all direct anterior hip replacement. Knee replacement, we do both robotic and non-robotic surgery. Some of the newer technologies that have been coming out recently are robotics especially. They do require some imaging to be done before surgery, but they're very helpful in assisting us in placing the implants as accurately and precisely as possible. One new trend in hip and knee replacement that's been shown to improve patient outcomes is same-day surgery. The majority of patients can safely go home the day of surgery these days and avoid staying in the hospital overnight. That's not always appropriate, but in the right patients, we can decrease the risk of complications by getting them home quickly so that they can recover their best at home. With current hip and knee replacement implants, patients are able to return to all activities really without any restrictions. The implants last up to 30 years, so a lot of the restrictions patients were given in the past no longer apply. Hip and knee replacement is major surgery. We pride ourselves on communicating closely with your primary care physician on your care before and after surgery to ensure that you have everything you need for a successful recovery. Patients often ask, when is it time for me to do my joint replacement? The answer is really that differs for each patient. There are different things that people enjoy engaging in that their arthritis may limit or not limit to differing degrees. What we tell folks is when you're no longer able to lead the quality of life that you'd like, and the non-operative treatments are no longer able to give you relief, that's when joint replacement may make the most sense for you.